say since I got laid off, I've been trying to get another job, but there's no hiring, or another might say I should go to the doctor, but it's a distance and I cannot take time off work. Or better still, since I moved here, I have not really been able to meet people or make friends and acquaintances. But in all of that, it is important to know that when we talk about our mental and physical health, most times we focus on the things that we can see, the things that we can hold or even control, like the food we eat, doing exercises, visiting the doctor, and so on. But our health goes beyond the things that we can control, to our environment, to conditions in which we are born, how we grow, play, work, where we work, things we learn, our age, and all. And all of this are referred to as the social determinants of health. And these social determinants of health include factors like socioeconomic status, education, the physical environment, our employment, social support networks, as well as healthcare. All of this can be said to be social determinants of mental health, as well as health and mental health are both interdependent. For instance, you cannot expect an individual's health to improve when actually the mental health does not, and vice versa. And there are a couple of things to know about social determinants of health and, say, social determinants of mental health. Things to know about social determinants of health. Social determinants of health have a major impact on people's health and well-being, and they are key focus of Healthy People 2013. Also, social determinants of health contributes to a wide array of health disparities and inequities. For example, pregnant women who live in a maternity care desert, that's a place who live in places that are far away from hospitals or birthing centers, are more likely to experience pregnancy complications, or people who do not have access to grocery stores with healthy foods with healthy foods are less likely to have good nutrition, and that raises the risk of health conditions like heart diseases, diabetes, obesity, and even lower life expectancy relative to people who do have access to good food or do have access to birthing centers and so on. Also, we can say that social determinants of health have complex impacts on our health and mental health. And lastly, the impact of social determinants might not be immediate, but reveal itself over time or over a long period of time in times of crisis.